For us in maternity, we've been able to use the transformative care process to really improve the environment.
Everybody's been very friendly and very helpful, which is a big thing. Quite often you hear about being released quite quickly after having a baby. It was nice to be able to spend a bit of time here and gain some support and some help with establishing feeding patterns and just generally getting used to being a mum, really.
We knew that there were issues on the ward. We'd surveyed mums and staff prior to undertaking the transforming care process, and that had really highlighted the issues for the women. They had difficulty understanding why they had to wait so long to go home. It's been a really interesting process to see how we actually function as midwives. Introducing any change isn't easy.
When the facilitator came to say that we were doing transforming care, my initial reaction was not something else now. So I wasn't very impressed initially. However, having been through the process, I now think it's been a wonderful opportunity for the ward, and we have changed so many things. The discharge process is a lengthy one, and a lot of the frustration that we see on the ward is to do with people going home. But there are so many parts to the discharge that we felt if we could change one bit of it to make that easier, then we would be improving something.
The interruptions to the midwives giving direct care to the women had dropped substantially. We also measured the time that it took to process the discharge on the PC. The process was more than 50% quicker.
Initially on the ward, the layout was a bit higgledy-piggledy. Everybody was, where was this, where was that? Now we know where everything is kept. They know the stock levels. I know when the level's low, what is needed, required on a weekly basis.
If I've asked somebody for something, it's not taken them long to, they've gone and got it straight away. I think everybody knows where things are and they don't hesitate to go and get something for you.
So this is our Know How You're Doing board, which we introduced several months ago and has evolved as the time has gone on, as we've gained more information about and knowledge about transforming care. It's in a public place, so we put it here so it engenders a sense of communication and discussion amongst the women and visitors and the staff.
I think some of the wards have really moved from a culture whereby they felt they were powerless to make any changes, or perhaps for years have been told that no, things couldn't happen, there wasn't money, etc. But certainly what this programme has allowed them to do is come up with there's very simple changes in many aspects that don't actually cost very much money, and has allowed them the time and the space and sometimes a little bit of resource to make those changes. None of us comes into work to want to give anything but the best care, and this has allowed us more time with the women and their babies, and that's as good as it gets, really.
I have found that since transforming care, I'm called away less, I'm interrupted less, because people know that that's what we're trying to achieve. So, when I can complete a check and do a discharge without being interrupted, that for me is great, because I know that that woman is satisfied by that, and that really makes me happy.